Female reproductive system, life-giving anatomy and physiology, a comprehensive view of the female reproductive system. Hello, welcome to the Science Guide ASAP Learning. Today we are going to be speaking about the anatomy and physiology of the female reproductive system. Hope this helps. Please support this new channel by liking this video and subscribing for more videos like this one. Be sure to watch the other videos in this anatomy and physiology playlist. The female reproductive system includes the ovaries, fallopian tubes, uterus, cervix, and vagina. Its main functions are to produce and transport eggs, provide a site for fertilization and implantation of a fertilized egg, and support the growth and development of a fetus during pregnancy. The ovaries are the primary reproductive organs in women. They are located on either side of the uterus and are responsible for producing and releasing eggs, as well as producing the hormones estrogen and progesterone. The eggs are transported from the ovaries through the fallopian tubes to the uterus. The fallopian tubes are a pair of tubes that extend from the ovaries to the uterus. They are lined with cilia, which help to move the egg towards the uterus. Fertilization usually occurs in the fallopian tubes when sperm meets the egg. The uterus is a muscular organ located in the lower abdomen. It is responsible for supporting the growth and development of a fetus during pregnancy. The uterus is lined with the endometrium, which thickens and prepares for the implantation of a fertilized egg. If the egg is not fertilized, the endometrium is shed during menstruation. The cervix is the lower part of the uterus that opens into the vagina. It contains a small opening called the cervical os, which allows menstrual blood to flow out of the uterus and sperm to enter during intercourse. The vagina is a muscular canal that extends from the cervix to the external genitalia. It is the site of sexual intercourse and also serves as the birth canal during delivery. The female reproductive system is regulated by a complex interplay of hormones, including estrogen, progesterone, follicle-stimulating hormone, FSH, and luteinizing hormone, LH. The hypothalamus and pituitary gland in the brain are responsible for regulating the production of these hormones, which are necessary for the normal functioning of the female reproductive system. During the menstrual cycle, the ovaries release an egg, which travels through the fallopian tubes to the uterus. If the egg is fertilized by sperm, it implants in the uterus and begins to develop into a fetus. If the egg is not fertilized, the uterus sheds its lining during menstruation. The female reproductive system is subject to a range of disorders and diseases, including infertility, polycystic ovary syndrome, PCOS, endometriosis, and cervical cancer. However, advances in medical science have made it possible to treat many of these conditions and to help women maintain their reproductive health and function throughout their lives. The female reproductive system undergoes significant changes throughout a woman's life. Puberty marks the onset of the reproductive life of a woman, characterized by the onset of menstrual cycles and the ability to conceive. The menstrual cycle is a complex series of hormonal and physiological events that occur over approximately 28 days, with variations between individuals. Pregnancy is another significant physiological event in the female reproductive system. During pregnancy, the uterus grows and changes to accommodate the developing fetus, and hormones such as estrogen and progesterone increase to support fetal growth and development. The placenta, a specialized organ that forms during pregnancy, plays a critical role in facilitating the exchange of nutrients and waste products between the mother and fetus. The female reproductive system is also subject to a range of disorders and diseases that can affect its function and health. Some of these include sexually transmitted infections, pelvic inflammatory disease, ovarian cysts, and uterine fibroids. Regular gynecological checkups and screening tests, such as pap smears and mammograms, are important for maintaining reproductive health and detecting any potential issues early on. In addition to physical health, the female reproductive system can also have an impact on mental health and well-being. Menstrual-related mood disorders, such as premenstrual dysphoric disorder, PMDD, can have a significant impact on quality of life for some women. Infertility, or the inability to conceive, can also be emotionally challenging for many couples. Advancements in medical science have led to a range of treatments and interventions to address reproductive health issues. These include hormonal therapies, surgical procedures, and assisted reproductive technologies such as in vitro fertilization, IVF. Overall, a better understanding of the anatomy and physiology of the female reproductive system has led to significant improvements in reproductive health outcomes for women. The female reproductive system is responsible for the production and transportation of eggs, as well as providing an environment for fertilization, pregnancy, and childbirth. The ovaries, which are located in the lower abdomen, produce and release eggs during the menstrual cycle. These eggs are then transported through the fallopian tubes to the uterus, where they may be fertilized by sperm and implant to develop into a fetus. The uterus is a muscular organ that can expand and contract, allowing it to accommodate a growing fetus during pregnancy and contract during childbirth to expel the baby. The cervix, which is the lower part of the uterus, opens during childbirth to allow the baby to pass through the birth canal. The female reproductive system also includes the vagina, which is a muscular tube that connects the uterus to the outside of the body. The vagina has several functions, including sexual intercourse, the passage of menstrual blood, and childbirth. Hormones play a crucial role in regulating the female reproductive system. The hypothalamus in the brain releases gonadotropin-releasing hormone, GnRH, which stimulates the pituitary gland to release follicle-stimulating hormone, FSH, and luteinizing hormone, LH. These hormones stimulate the ovaries to produce and release eggs, as well as regulate the menstrual cycle. During menopause, which typically occurs between the ages of 45 and 55, the ovaries stop producing eggs and levels of estrogen and progesterone decrease. This can cause a range of symptoms, such as hot flashes, vaginal dryness, and mood changes. Like any other body system, the female reproductive system is also susceptible to diseases and conditions. These can include infections such as yeast infections and bacterial vaginosis, as well as cancers such as ovarian cancer and cervical cancer. It is important to practice safe sex and seek medical attention for any concerning symptoms to maintain reproductive health. Hope this helps. Please support this new channel by liking this video and subscribing for more videos like this one. Be sure to watch the other videos in this Anatomy and Physiology playlist.